we will talk about how to index scan documents in Healthquest. In order to index scan documents, we will go to Admin, Index Scan Documents. The document I'm looking at is just the first document that is on the list of all the scanned documents that need to be filed away. In order to start this process, I need to find my client. So this document belongs to Calvin Thompson, and we will look for Calvin. We can just type the first couple of letters of the last name. Of course, the long list of patients will come up. To shorten the list, we can type comma and then a couple of letters of the first name, and it will streamline the list. We can find our patient. To file this report, we need to name it. All the names of the scanned documents can be found in the type list. This list is customizable. Healthquest program allows each clinic to come up with its own keywords and put them into this list in order to create your own individualistic list of scanned documents. Your clinic might want to use something general like consultation letter, or if your clinic is specialist clinic and you want to use some very specific names, you can use something like GI consult. Again, these choices are very specific to your clinic, and you can choose the keywords according to your needs. Important advice would be that your clinic decides on the keywords together, so everybody in the clinic that are using this feature of indexing scan documents will know which names, which keywords to use in order to file the documents appropriately. This feature becomes very important when you use the search function in Healthquest, because then it streamlines all your search and it becomes quite easy. So if I decide that this is a consultation letter, I will choose that type. I might want to use the note field in order to specify where this consult letter is coming from. So if it comes from Dr. Green, I might want to say that. Again, it becomes important how to use these notes because they are searchable as well in Healthquest. So if your staff is using the notes, important to get together and decide how you're going to use it so it is uniform for your clinic. I can just file it away by simply click on Save. But if I decide that this letter needs to be viewed by my doctor in the clinic, I will want to mark Review By. Then in the list of the doctors, I will choose the appropriate doctor that needs to review this letter. I might also decide that this is very urgent report and the doctor needs to see it first. In order to do that, I will click on Urgent. What it will do is this letter will be put on the top of all the scanned documents for the doctor's view, and also it will have an exclamation mark beside it just to show the urgency of this report. There is another feature in this same field which is called Handout. We can scan any pamphlets or any information that the doctors want to use in order to educate the patients. We just simply scan it into Healthquest like you do any other scans. And when it appears in your scanned list, we can say this document needs to be scanned as a handout. There is a file in the patient's chart which is separate from the individual documents that belong just to that patient. That file is visible from all the charts and it is very easy to use. In order to put this specific document into that file, I will be using just the notes and I will want to name this document for easy find for the doctor. So normally the clinics will decide to use the title of that document. In this case, it's History and Physical. Once I name that document, all I have to do is click on Save as a Handout, in which way this document will appear in the file for the handouts only. Even though I have the previous patient's name, Calvin Thompson, and I have the type consultation letter, once you click on the Save as a Handout, the program recognizes the previous information as not relevant, and it will not use the name or the type in the handout. So it is separating the handout from the rest of the files.